when we first were going live, we had a lot of information up in the practice. We had things on the walls, we had a display up, we had lots of leaflets around. We were all very enthusiastic about it and made sure we sat down and explained fully what happened every time we did anything with EPS version 2. As time's gone on, obviously we've taken the display down because we put other things up, and I think now patient expectation sometimes still needs to be explained. If you're seeing somebody in the consulting room and doing an acute prescription and you've explained electronic prescribing to them, they assume sometimes that they go straight round to the chemist, and in our case it's only next door, so they're in there in a couple of minutes and then they're back in the surgery asking you where the prescription is. So I think it's important to explain that it does actually take a few minutes. It's not a long time, but it may be 10-15 minutes before their prescription will actually be bagged on the counter for them. The other thing that you need to be aware of is we've got this thing about what we call non-DMD, and it's things that haven't been matched, and currently it's a lot of the dressings and appliances, things like that, that will be available to be prescribed EPS version 2, but currently they're not. So you may have somebody who's signed up for EPS version 2 for most of the repeats, and then suddenly you find you've got something coming through as an acute that you can't actually issue EPS version 2. We will still generate an FP10 for the non-DMD item, but then the chemist will pick it up, or somebody will drop it around to the chemist, so it's not inconvenient for the patient. But obviously, as more chemists become available to use EPS version 2, that facility is not going to be available, but the chemist is just next door to you. So you've then got to make a decision, are you doing part of the prescription electronically, or are you going to do it all on FP10?